This is Dr. James with Helpmommy.com. And today we're going to talk on our part 4 of our 5-part series about 1-month-olds is the scary stuff. There are some scary things that show up or could happen at a month-old. So let's just talk about those. So number 1 is illness. Babies at 1-month-old just don't have a great immune system. Their vaccines haven't been given. They are just a totally immunocompromised mess. And we start to feel a little more comfortable with them. That first month, a mom just doesn't feel good. I mean, she just delivered a baby, and of course we're scared. But at a month old, things start to become a little more routine. We're a little more, used to our baby. We're feeling better as parents. And so we'd really like to show off our baby. Most of the illnesses that babies can get are airborne. And so there's a lot of spread there. And so one of the things that we worry about is them getting sick. And especially in the winter months, illnesses like influenza, especially RSV, croup, can make a baby very sick. Other things that can cause bacterial meningitis, they're still susceptible to. And a lot of these bacteria that can cause meningitis live normally in people's noses and throats. And so we worry about Haemophilus and strep pneumonia. So try and keep your baby away from crowded places. Try and make sure everybody's washing their hands real good. And still worry about any fever that your baby might have, anything above 100.4. These could be considered emergencies, need to be seen right away. Other things is there's a condition called pyloric stenosis that can show up around the time that a baby's 4 to 8 weeks old. Again, this is a range. Can it show up earlier? Absolutely. Could it show up later? Yes. This is going to be a baby that's going to start having projectile vomiting. And this vomiting is going to be almost like they're vomiting for a record. Each time it's like it goes farther. And when we're talking about projectile, it means it's coming out with force. What pyloric stenosis is a muscle between their stomach and their small intestine that kind of acts as a valve to keep the contents of the stomach in a little bit longer, and then it's supposed to relax and allow the contents of the stomach, when the stomach contracts, to go from the stomach to the small intestine. But if it starts to hypertrophy and get thick, then when the stomach contracts, it can't go out. And so it goes out their mouth. And this is something that over time, it's getting worse. And so these babies start puking harder and harder and harder. A lot of times from the time that they start having these symptoms until they have to have surgery is sometimes within a couple days. And this is something that is surgically corrected. It's called a pyloroplasty, and your babies afterwards will be fine. But it is fairly traumatic to know that your baby's going to be put under anesthesia and have to have surgery. But do know it's a very common surgery, and it's something that will fix this problem. But it usually shows up right around the time they're a month old. A lot of times, another thing that we see at a month old is milk protein allergies. And this can happen in both breastfed and bottle-fed babies. Our bottle-fed babies are usually on a cow's milk-based protein, but moms usually eat a lot of dairy, and so there's a lot of milk protein that could end up in breast milk. To be honest, milk protein's in everything. So our 2 big milk proteins are casein and whey, and they use these in lots of food. So anything that you routinely think would be dairy, but also they use this in a lot of fillers. In fact, I think one time I looked and there was only one prenatal vitamin that didn't have a milk protein in it. So it's really hard to get it completely eliminated out of a mom's diet. These babies are going to show up a lot of times with just fussy. They may have some eczema. They may not be growing the way they're supposed to. And they may have very mucousy and sometimes bloody stools. A lot of times the doctor will diagnose this by doing a test for blood in the stool called a hemocolt to look for the presence of blood. And then after that, start looking to see what kind of milk we could go on. In a case of a breastfed baby, we'll try to do an elimination diet where we try and remove all milk protein from mom's diet. Again, very hard to do, and it takes a while before you see the results. In other babies, you may go to a soy formula, although there's a lot of cross-reactivity between those allergies. And then they go to, a lot of the hydrolyzed formulas that are called hypoallergenic, things like Nutramigen or Alimentum. Sometimes that won't work. And then we go to what's called the elemental formulas, where they're truly amino acids. And there's 2 or 3 of those on the market that we may try. This is something that takes trial and error. It takes a while. I have had babies that were allergic to things other than cow's milk. I have had a couple babies that were allergic to corn. And so there are some corn products in some of the formulas. And so that sometimes was an issue as well. Another thing that shows up at a month is colic. And these are babies that are just so fussy. I almost can always tell my moms that have a colicky baby because they don't stop bouncing. These babies are only really happy if they are moving. And even when you start a movement, it's like you may get them calm for a little bit and then you have to change movement. And so this is a very nerve-wracking time because these babies are just not happy and they scream. A lot of times you can almost set your watch to when they're going to start screaming. They will scream for hours at a time. I tell parents that sometimes these babies are just unhappy and you're not going to make them happy. Sometimes it's better for your peace and quiet, your nerves, just to put the baby down for a little bit. Walk away. Take some deep breaths. Don't feel guilty that your baby's screaming. They were screaming when you were holding them. There are different things we try. I will try things, of course, I try things like the moving. I try white noise. I try some little vibrating things that can go on the bed that can sometimes calm them down. We'll go for car rides. There's a product on the market that's a probiotic called Soothe, Soothe. It's put out by the Good Start Formula Company. It has some good effects. It's a probiotic and it's pretty easy to use. And my formula fed babies sometimes will change formula to a partially hydrolyzed formula so that the protein's not as big. There's even some medicines that we can try and use to try and calm these babies down. Usually shows up around the time they're a month old and can last anywhere from 2 weeks to 2 months. And I have had cases where it lasted even longer. This is very hard on a family because these babies are they're nerve-wracking how much they cry. The other thing that we see at a month old is reflux. If you have reflux, and to be honest, all babies have reflux, but you could have enough reflux by the time they're a month old that they've burnt their esophagus. This is going to, again, start to present itself as pain. A lot of times we'll see babies that as they go to eat, they'll push away crying because it hurts to swallow. Then they'll come back and eat because they're hungry and then push away. On the third or fourth time, they'll coat enough of their esophagus that it won't hurt. These babies will also do a lot of arching afterwards. Now, every baby can cry and pull away. Every baby can arch. But if you see this persistently with each feed and it seems to be getting worse, it's definitely time to go talk to your doctor. The other thing is having some realistic ideas about reflux because we don't really have any medicines that make them not spit up. We have medicines that decrease the stomach acid so that hopefully it doesn't hurt as much and that burn that they've had to their esophagus will heal up and do better. So those are the big things that show up at a month. There's things that get better at a month, don't get me wrong. But those, when parents are scared about a lot of things, those are the things that as a pediatrician, we're looking at in a month to try and make sure that nothing bad's going on. And those are the most common things that we see. Hope that helps you with your 1 month old.